show up for one. And if this was going to be way too redundant for two, this is my third year in a row sharing my story. But the one thing that I've realized is, at least in my case, I think it goes across the board though, that recovery is anything but consistent and boring. Every other time that I've spoken, I have been recovering for something other than myself. And I think the first year was, I was recovering to stay in school because my treatment team was kind of like, I don't know, you might need to take a break. And then the second year that I spoke, I was recovering to go to India because I won a scholarship. And then when I shared my story last year, I said that I recovered for India and I stayed in recovery because of India. And when I graduated in May, I had a very hard time adjusting. I do not like changes whatsoever. And I had a relapse. I'd say it actually started in April though, and it just kept going. And I had really screwed up my body, so while I wasn't feeding myself, my weight was still increasing because I actually set my body into starvation mode and gave myself hypothyroidism. So I just could not, my body was not functioning at its optimal levels. Right after Thanksgiving, I was diagnosed with fibromyalgia, and that was actually my wake-up call of I really need to recover for me. I can't just have some visual, actual, tangible goal, and then once I get it, to just call it quits. Like, it's great to have goals along with your recovery, but ultimately you need to choose to recover for yourself. And that was when it finally set in. So, for the first time, I will talk about my story in the sense that I'm recovering for me. Before we go into that though, I wanted to, I guess we're going right into that. So, those who are connected with me on social media saw this yesterday, and it's my transformation picture for my eating disorder. One thing that I have learned throughout my own recovery and listening to other people's stories is to do actual body transformations is not only triggering for people who may be struggling, but it's also just hammering in that sick enough label. Whenever we think about eating disorders, we think about the girl who you think you can see through, basically, or someone that's going to blow away in the wind, when really there is no definite size to determine whether or not someone has an eating disorder. They all come in one size, and that size is miserable. So instead of doing what I was at my sickest, I gave you a list of the things that I struggled with at that time. I was a binge drinker. I struggled with restriction mainly, and then I would drink because then I wasn't purging if I vomited. I drank too much. Or if I purged, I was doing it so I wouldn't be hungover. It gave me an excuse. I was in an abusive relationship for 1.5 years, and I actually have physical scars from it. I was a liar. I lied to my treatment team. I lied to myself. I lied to the people closest to me because of shame. I would fudge my meal logs for my dietitian and my therapist, even though they both knew that I wasn't eating what I said I was, but I had it in my head that I was tricking everyone. Dizzy spells, dry and flaky skin. My hair quit growing at the time that I wanted it to grow. And that skin and hair growth are actually the two of the first things to go when your body is not getting the proper nutrition, because those are not super important parts of keeping your body together. So your body will focus more on the vital organs than regulating your skin and hair. I was addicted to diet pills, which I don't know if you're aware of this. Diet pills are basically speed. They're just condensed caffeine that I had a lot of heart problems due to that. Insomnia. I did not sleep at night. I would try to take naps during the day. I struggled with a lot of self-harm in all forms, really. My eating disorder has been my go-to self-harm. I would restrict and purge, and that was my catharsis. But there were times when I would feel numb, and I would self-harm in order to actually feel something. I had a lot of suicidal ideation, which that is also called passively suicidal, meaning I never had a plan, but I really didn't want to exist. I had broken friendships. It's really hard to be there for someone who's constantly lying and avoiding any sort of meal or food, because if you really look at it, everything revolves around some sort of food. It's just how we socialize in this culture. I had zero focus. My grades slipped a few times. Then I would recover or try to recover, and then I get my grades back up, but there were a couple dips. Lack of confidence, I think, speaks enough for itself. The flat affect, as I said, I would be numb, and it would be very apparent. I would have no emotion in my face. It was almost like I wasn't there. And that would be the dead eyes as well. Compulsive weighing. This has actually been one of the more embarrassing things for me. I've had multiple scales. I would weigh in between them to see the difference. And any sort of weighing, it had to be done 3 times to see if it was actually staying the same. I carried my scale into the bathroom stalls with me. I would sometimes weigh myself before and after blowing my nose. Cavities. Actually, I just had a dentist appointment, and it was the first time since my eating disorder went full-blown that I didn't have cavities. Due to the stomach acid from purging, it wears down the teeth enamel and really weakens them. The bottom of my teeth are see-through, and that's actually one of the things I'm more self-conscious about. Impaired memory. I think this is probably one of the more notable things for me is I don't remember my sophomore year of college at all. It's just a complete blank. Isolation, dependency on laxatives. I abused them to the point that my digestive system did not work without them. I have since gotten that under control. Depression and mood swings. So what eating disorders are, there's several different types, but they all involve an extreme emotion, attitude, and behavior surrounding weight, food, and size. They're serious health disorders with both emotional and physical problems, which makes it very tricky to treat, especially because especially in this area, and I now live in Meadville, the doctors are not trained to deal with eating disorders. They think because it's in the DSM, they don't have to, but there are so many different things that need to be monitored: blood tests, blood sugars, blood pressure, temperature, and weight is just a side effect. And I think one of the biggest myths is that it's a white teenage girl disease, any sort of eating disorder, but the truth is they affect everyone globally. There are different things that will predispose you to an eating disorder, which I will talk about after I go over the most common ones. Anorexia nervosa is the one that typically, when somebody mentions an eating disorder, you picture in your mind. These are people who are at a critically low body weight due to their own self-infliction. Some people naturally have low body weight, but this is caused by inadequate food intake. not feeding your body, so it breaks down the muscles and fat in order to keep working. Osteoporosis, this is especially common in people who have struggled at a younger age and ongoing, because when you're a child, that's when the majority of your bone density is developing. So if you're not properly feeding your body, it's not getting your bones aren't getting the calcium and everything that they need, which can lead to osteoporosis, severe dehydration, and kidney failure as well. Some of the things, like if you wanted to, please don't go out in the airline, everyone, it's not fun. But if you have someone that you love and these are popping into your mind, it might be a good time to talk about it. So if someone has dramatic weight loss and they're preoccupied with their weight and dieting, refusal to eat certain foods, or even just a refusal to go out with you to meals, like go to the cafe or the bistro, like every single time they have an excuse. And if they have become more withdrawn and isolated. Bulimia nervosa is characterized by a binge purge cycle. So people with bulimia will often restrict as well, which is what can tend to cause a binge. It's a psychological control thing. But purging consists of self-induced vomiting, compulsive exercise, and laxative abuse. And health consequences are tooth decay. You can actually rupture your esophagus and stomach due to the binging. Bulimia often shows up more in the blood work because of the electrolyte imbalances, and there's chronic irregular digestive system. These are some of the warning signs to keep in mind. So frequent trips to the bathroom, especially right after meals. Excessive rigid exercise. You'll notice not only discoloration or staining of the teeth, but also the fingernails and knuckles. And then the same with the withdrawal and continued exercise. Another common thing is calluses on the back of hands and knuckles, and sometimes there will be scratches as well from the teeth touching. Binge eating disorder. Now, binge eating disorder has been around as long as anorexia and bulimia, but it's recently become more openly talked about because it's becoming more prevalent. What's different from binge eating disorder and bulimia is that there's no compensatory behavior, there's no purging afterwards, but it's still filled with the shame and guilt. And I guess one of the things that, this was something I didn't understand either. One of the common misconceptions of a binge is that it's just simply overeating. Binges are premeditated things, situations where you plan everything that you're going to eat. It's more than mindlessly eating, and it's more than what we all do at Thanksgiving. It's a premeditated sitting of consuming an unusually large amount of food. These health consequences, it can cause a lot of weight gain, especially because they aren't using, which is good that they aren't using compensatory behaviors, but with them not having a regular exercise or anything and they're eating the extra calories. It can cause type 2 diabetes, high blood pressure, gallbladder disease, and musculoskeletal problems, which comes a lot from the weight gain. And then the warning signs would be secretive about eating. People who struggle with binging often like to eat in private and furtively. It's a euphoria. There will be repeated episodes of dieting or attempts at weight loss. Large amounts of food may be missing, and larger than normal amounts of money spent on food. And there's often secret stashes. Avoiding restrictive food intake disorder. So this is more than just being a picky eater. You know, kids are like, no, I'll only eat mac and cheese, or I'll only eat the chicken fingers and french fries at the restaurant. This is having rigid rules. I think what I would say to make this easier to understand is that it's very, very similar to anorexia, but it doesn't have the severity of the low weight. It will cause a lot of the same health consequences as anorexia. So this would be restricted or reduced food intake, frequent complaints about bodily discomfort with no organic cause. So oftentimes people will call people who go to the doctor a lot hypochondriac, or try to say that they have Munchausen syndrome, which actually, when I was going through the process of getting diagnosed with fibromyalgia, I had a lot of people tell me there's nothing wrong with you, everything's coming back normal, until my doctor actually took and did the pain inventory and was like, oh, I guess there is actually an issue. So they'll have a lot of body issues, but there's nothing showing up in the blood work. There's no physical reason for them to feel that way. There will be a lack of appetite or interest in food, and fear of negative effects of eating food. This is more than, this isn't really about the weight. This is more about they don't want to choke or they don't want to throw up. There's an inability or reluctance to eat in front of others, and picky eating that is unresolved by late childhood. OSFED is one of the most common eating disorders because it's really hard. Psychology loves to use the DSM, and it's fantastic that they're able to sit out the guidelines for what a disorder is, but sometimes we don't meet the criteria. So OSFED, while it seems like a blanket statement, it's for the people who, people who struggle with this are just as severely struggling as somebody with anorexia or bulimia or binge eating disorder. Oftentimes, OSFED will have a higher mortality rate because it's not taken seriously. The warning signs are quite consistent among all of them. There will be a preoccupation with weight, but not as consistent as found as anorexia, bulimia, or binge eating. Increased isolation, depression, or irritability, and compulsive or obsessive exercising. So in all of these, I went over about how they are serious and can be life-threatening. They are also treatable. I have developed a treatment team, and it took quite a bit of time to get the right components. I finally have a dietitian that actually specializes in eating disorders, and she's fantastic. But a dietitian is very helpful for learning how to eat normally, how to have a balanced meal, because I can tell you this, having struggled with an eating disorder for the majority of my life, I know a lot about food. I know a lot about what I should be eating, but it comes from a place of fear and also just a place of not feeling worth it. I deny myself basic human rights. A therapist is crucial to someone who is struggling. They can help with the emotional turmoil that you're going through. My eating disorder was used because I couldn't feel the emotions. I didn't feel capable of doing it. And so it was a coping mechanism. When you stop those behaviors, all of the emotions that you've refused to feel come bubbling up, and it can be extremely overwhelming to go through. So having a therapist to help you sort through that is very beneficial. It's important someone that's actually trained in what they're doing is a really important part of the treatment team as well. And oftentimes people will utilize a psychiatrist for medication management if they need antidepressants or anti-anxieties. Eating disorders are very often not a sole disorder that someone will struggle with. I also have depression and PTSD, which can actually be a contributing factor. There's biological, interpersonal, psychological, and social factors. So psychological, I have depression, anxiety, and I struggle with a low self-esteem. My PTSD comes in due to the trauma I went through when I was very young and really struggling to accept my body as it aged. Biological, there is a huge genetic component to eating disorders. Interpersonal, so as I said, I used my eating disorder because I couldn't process my emotions. So if you have difficulty expressing your emotions, you are more likely to utilize these behaviors. And then cultural norms. We see in the media constantly how we should change our bodies. I've already touched on the co-occurring disorders a bit. As many as 20 million females and 10 million males in the United States will struggle with a clinically significant eating disorder at some point in their life. So this is one of the things that I wanted to talk about more this time specifically, is on how to help a loved one if you have someone that you know that is struggling, or if you yourself are struggling and you want to vocalize how someone can be a support for you. It is important to learn as much as you can about eating disorders because they're very complex. But please do not place shame, blame, or guilt. That the eating disorder manifests enough of that to place that onto the sufferer does not help anyone. Be honest and vocal about your concerns, but do not make rules or promises that you cannot or will not uphold. Don't guilt someone into going to treatment. Don't give ultimatums. Be caring but be firm. And do not give simple solutions. If I had if I had $5 for every time somebody said, well, why don't you just eat, or why don't you just stop throwing up, or stop using laxatives, I could probably pay off my college debt. But it's not that easy. That's why it's an eating disorder. Be a good role model and practice what you preach. If you're telling someone to love themselves, which is what we all need to do, make sure that you're not berating yourself in front of them. Really don't berate yourself at all, but make sure that you are upholding the same standards. And do not ignore or avoid the situation until it is severe or life-threatening. If you notice something, please speak up, because it's going to be awkward, it's going to be uncomfortable, and there might be some backlash from the person, but I'm grateful for the people that called me out on my bullshit because I needed it. And if you can't do it, tell a trusted adult. I mean, we're all adults, but tell someone that can address it. And something else I incorporated into this is compliments that aren't about physical appearance, because I think that, especially in this day and age, we focus way too much on what we look like or complimenting what each other looks like. So they're empowering. That sets my soul on fire. And to be told that, I like really good at writing them down and then not using them. But they are a crucial part to changing a framework. One of my favorite ones is 10, You Have a Beautiful Soul. And that was something that spoke volumes to me when I was in India. I have the Hindi version tattooed on my bicep, which is Sundar Atma. I think it's definitely important to try to compliment the actual person and not what they look like. So treatment of eating disorders. There's the intervention, which is the part that you can help with. There's the professional treatment, ongoing support, and recovery, which recovery is the sufferer's own personal journey. Seeking treatment, which I've talked with you all about the different aspects of the team. Levels of care. So there's a lot of confusion sometimes for people. Inpatient is an actual hospital setting. That's when their vitals are not stable. The entire patient is medically unstable. And it can be co-occurring with psychiatrically unstable, so they could be suicidal as well, or having psychosis. Residential treatment, so this can only be utilized if your vitals are not critically unstable. And this is more, residential treatment tends to be more long-term than inpatient. I have not done residential treatment. Inpatient treatment is very fast-paced. They are trying to get you stable and send you on to the next level of care. Where residential can take the time and actually do the therapy-based work and focus on the root causes of your eating disorder. Partial hospitalization. So I did a partial as the step down from the inpatient, where I was still being heavily monitored for my vitals and my progress, and given the support that I needed at that time. Then there's intensive outpatient and outpatient. So intensive outpatient is more intense than outpatient itself, but it's therapy 2 to 3 times a week, where outpatient, sometimes people only go once a month. I actually, I see 2 therapists due to some co-occurring issues. So I technically have therapy twice a week, but it would still be considered just regular outpatient. And this year's theme for NEDA is, it's time to talk about it. And I think it's important to talk about eating disorders. There are different ways to talk about them. It's important to not provide tips or play the number game. I still struggle to accept myself. I have used numbers so much in my mind that it's just difficult to even hear them. So if you know someone that's struggling or is in recovery, it's important to be mindful of what you say around them. Don't talk about how you just lost 5 pounds, because that might be triggering for them. Watch out for anorexia chic. So what that means is, do not romanticize them. There's tons of websites, Tumblr accounts and everything that are pro-Anna. He'll love me when I'm thinner. Those types of things. And it's important to really analyze Fitspiration as well, because there's this trend going on right now about focusing on clean eating and everything, and that's great if it works for your body, but there's such a thing as doing it to an extreme. So make sure that you're not romanticizing an eating disorder. Emphasize the seriousness of eating disorders without portraying them as hopeless. So they are lifelong. Recovery is something that I'm going to have to choose for the still have slip-ups. I actually just had one a week ago. But the one thing that's important to remember is that progress isn't linear. It's not perfect. It's not supposed to be. The one thing that I found most notable for me right now is that, while yes, I still slip up, I found it a lot easier to get back on track. I don't, just because I have a flat, I don't go and slash the other 3 tires like I used to. The valleys aren't as shallow anymore. And it's important not to focus on images or descriptions of the body at its unhealthiest point, which recovery is possible. Path to recovery is different for everyone, and each person's experience with an eating disorder is unique. I think that's what makes them so complex, is no two persons suffering, whether they have the same diagnosis, their experiences will not be the same. And there's also tons of information and resources at nationaleatingdisorders.org. They actually have this really awesome program called the Need a Navigator program. So if you know someone that's struggling, they can sign up for a person, and it's all through email, and it stops whenever you want to stop. I've utilized it a couple times actually, and it's someone who you set your preferences. So I always wanted someone who had gone through it, because that's just one of my own things. And they will email you and check in, and you can ask them for resources and help, and they'll be a support for you. They will also set their guidelines.